Hey everyone, good evening and welcome to Black Maternal Health Week. We are super excited to be getting started. We've been participating in tons of events already this amazing week to amplify the work of Black women scholarship, maternity care, and so many amazing things. This year marks the 5th year anniversary of Black Maternal Health Week. It's founded and led by the Black Mamas Matter Alliance and is a week of awareness, activism, and community building intended to deepen the national conversation about Black maternal health in the US, amplify community driven policy, research, and care solutions, center the voices of Black mamas, women, families, and stakeholders, provide a national platform for Black led entities and efforts on maternal health, birth, reproductive justice, and enhance community organizing on Black maternal health. This year's theme, Building for Liberation, Centering Black Mamas, Black Families, and Black Systems of Care, reflects BMMA's work in centering Black women's scholarship, maternity care work, advocacy across the full spectrum of sexual, maternal, and reproductive health care, services, programs, and initiatives. I am extremely honored about the 5 years of this, as I was one of the folks sitting in the room in 2017 where this campaign was first ideated. And so to see the beautiful manifestation of that work, of the folks who have been behind the scenes, the continuation of the work around reproductive justice as we honor our ancestors, as we honor those who have been doing this work since the beginning of time. I'm extremely honored. I'm Tanae Lynn Harris. I'm one of the co-founders of the Bloom Collective in Baltimore City. And I am, again, very, very grateful for you all joining us. And I am going to turn this over to Dr. Lauren Arrington.
Thank you so much, Tanae. And I am also very honored to be here tonight because we have a fantastic group of clinicians who work in many different settings and arenas to support the health and wellness of our community. I would like to first thank the Bloom Collective for creating this space for Black women and birthing people to gather and center their health and wellness. And I am primarily a midwife and also an educator, and also do some work around quality improvement and health equity. And tonight, I am just so excited that we are going to be talking about health and liberation, two topics that are very dear to my heart. And I want to thank Black Mamas Matter Alliance for all the work that they do and for pushing us to think beyond health as survival, but instead health as wellness, joy, and liberation. So during our conversation today, we are going to take this concept of health and liberation and try to break it down into the tangible reality of health and healthcare in our daily lives. And as we get started, I'd like to just highlight some of the ideas that come to my mind when I think of liberation and health. And so I think we have to call in the Black feminist perspective when we think about liberation. And from that perspective, we know that liberation is not a solitary act. As Fannie Lou Hamer said, nobody's free until everybody's free. And the Black feminist Combahee River Collective was very clear that in order to liberate our community, we have to liberate those that are most oppressed. And one of the things they said about liberation is that we recognize that liberation of all oppressed people necessitates the destruction of the political, economic systems of capitalism and imperialism, as well as patriarchy. And so it's a wonderful reminder that our health does not happen in a silo, that it is very much connected to the other systems that impact our lives. And as we think about liberation, there's also this wonderful opportunity to dream and remind ourselves that we don't need to accept our current reality or other people's definitions of what we should aspire to for health and wellness. And a common example of our need to do this is the way that we often see maternal health outcomes of Black women and birthing people compared to those of white women and birthing people, with the message that as Black women, we should aspire to have the same outcomes as our white counterparts. Yet we know that on a global level, the outcomes of white women in the United States are also problematic. And at the end of the day, we need to define our aspirations for health and wellness. And while data on health outcomes provides relevant information along this journey, our health is far more expansive than that. And so, with that in mind, I think we also can call in that idea of radical imagination, a wonderful social justice concept where we imagine the world, life, and social institutions not as they are, but as they might otherwise be, in a world where we don't have all these isms that are so bad for our health. And radical imagination also calls on us to appreciate the hopes and dreams of and experiences of those who suffer the greatest oppression. So tonight, I hope our discussion can be a very creative one where we make new connections and discoveries about ourselves and the health and wellness and joy that we want for each other, and where we concretely share ideas for what that journey looks like now and tomorrow. And so I'm looking forward to just a wonderful conversation. And at the end, we'll try to save 10 to 15 minutes so that we can answer questions from the audience. So please, as the conversation evolves, please feel free to post those questions. So now I'd like to just say a little bit about our wonderful panelists tonight, and then let them tell you more about themselves and how they think about this concept of liberation and health. So we have Dr. Kai Parker, who is a naturopathic doctor, a doctor of Oriental medicine, and a midwife, and she has her own practice based in the DC, Maryland, Virginia area. We also have Dr. Lorena White, who is a physician, an acupuncturist, an herbal medicine practitioner who facilitates health, wellness, and healing for complex health challenges that many women face. We also have Dr. Modupe Age, who is an OBGYN physician, has a master's in public health, and is the director of the Bureau of Clinical Services for Baltimore County's Department of Health, and has worked as a clinician both in and outside of the United States. And we also have Dr. Michelle Ogunwole, who is a health disparities researcher, a social epidemiologist, and a general internal medicine physician specializing in the care of women with chronic medical conditions. She also has advanced training in quality improvement and is committed to social justice and health equity. So I'd like to jump right in with my first question, which is first just to allow our panelists to tell us anything else they'd like to share about their work, and also how they define liberation and health and how they work to support collective liberation, collective wellness, and collective care for Black people, Black mamas, and communities, and for themselves within that through the work that they do. And so to facilitate a nice flow tonight, I think what I'll do is just sort of have us go in an order, and I'll switch that order around with each question, but that way everyone can just jump right in. And so why don't we start with Dr. Michelle Ogunwole, and then Dr. Kai Parker, and then Dr. Lorena White, and then Dr. Modupe Age. So we'll go in that order for this first question. And thank you all so much.
Thank you so much for that that introduction. I'm so thrilled to be here and just to be supporting this work. I think that the question you were asking is how we think about liberation and health. And I can just talk a little bit about the work that I do and kind of what's been central to what drives the work that I do. So one of the things that's very central to my work is the idea of love. I think for me in medicine and science, when we think about, this work, love doesn't always come up in kind of our research or our clinical practice. But it's something that I think is extremely important when we think about healing and what we're going to center in terms of Black women, Black birthing people, and what they deserve. And so it's something that I've worked really hard to center in my own work, thinking about how love can guide us and how it anchors us. And if we keep that in the forefront of our mind and really truly believe that that's what Black women and Black birthing people are deserving of, that it'll lead us towards liberation. And so I think that for me, I think it's important for us to think that we have to look at our liberation and make sure that love is involved in our liberation. And so I think a lot about, I don't want our communities to heal if it cost us our lives, our sanity, our joy, and if it takes more than it gives. So as we strive for liberation, that we, try to remain whole in that. And so that's a central idea in my work. And I think the other part for me has always been sisterhood. And so, sisterhood is very central to the work that I do. And the idea that you don't leave your sisters behind and that we are our sister's keeper. And thinking about how if we all came, with that kind of approach to our work, what it would mean for our communities. And so, those are just a few of the things that I certainly think about as we, try to move this work forward. And yeah, I think those are just some general thoughts. And Lauren, I didn't know if you wanted us to go into anything else about more specific about our work, and I'm sure that we'll talk about that. But I would say for me, it's about love and sisterhood.
That's beautiful. Thank you so much, Dr. Kai Parker.
Hello, everyone. I am Dr. Kai Parker, and thank you so much for having me here today. I think of liberation as the ability to peacefully show up as I am, the ability to peacefully show up as we are. And as it relates to health, I think, and especially women's health right now, I think that one of my biggest concerns is that so many of us are not able to show up as we are and get the care that we deserve. Definitely something that I am very concerned with at the moment, and trying to do something about. For me, I really strive to support collective wellness by remembering that the word doctor comes from the Latin word docere, which means to teach. And somehow we forgot that, right? Like we were all trained to be doctors, right? But we were trained to be teachers. We were trained to give information. And so for me, it's really big to teach my clients, because it's not enough to say, do this because I say so and because I've been to medical school and I know more than you about your body. Wait a minute, right? They are the experts. So I really try to help them remember that, and help them remember that they are the ones who are in charge of their health and their conditions. And in many places in medicine, we're not doing that. We're not empowering our clients. But that's definitely how I do it. Just remembering that I am there to be a teacher. And every time I teach somebody something, that is something that they can now take to their family members and friends, even if I don't want them to. At my son's birthday party last weekend, I had someone tell me, your godmother told me that I should take this for my blood pressure. And I went into my doctor and my blood pressure was fantastic. Now, listen, I do not want people being doctors for others in dangerous situations. However, I'm very big on teaching people how to be their own doctors and helping them just pass on the knowledge they have to others.
Thank you so much, Dr. Lorena White. I think you're muted, Dr. Lorena.
I am. I definitely am. That was one of the things I was told myself I wasn't going to do, stay and continue talking. Again, thank you for the introductions, and thank you for the invitation to be a part of this panel. I'm already being inspired just by the words that I'm hearing each of you speak. When I think about liberation and health, I think of the word sabona, and I think of being seen, being heard, being valued in totality of the woman, the person that we are. And oftentimes that it gets overlooked, it gets overshadowed by conditions, by ailments, by maladies. And we oftentimes enter in as a collection or compilation of those things. And being free to be who we are, but also to be seen as whole, to be seen and valued as whole, and to be listened to and heard as we present our conditions. And oftentimes we are, again, defined by those conditions, and very rarely ever are we seen as a whole person, and just, again, the compilation of symptoms or the constellation of symptoms. So when I think of liberation and health, I think of being free of all the shackles that have been hampering many of us, from chronic conditions, intergenerational trauma, and just a myriad of all the other things we have to do just to get access to the system, and to be valued in the system, and to be able to get the treatment and have the treatment options that we need, want, and desire and deserve. And so when I, again, thinking of liberation and health, just that being seen, being valued, and being heard as the people that we are.
Thank you so much. And Dr. Modupe-Age.
Wow. First of all, thank you for having me here, Lauren. It was really a privilege to be a part of this panel. And as Dr. Lorena White said, hearing what my sisters have to say here is very inspiring. So when I hear of liberation in healthcare, there's so much that comes to mind. But first, when I think of liberation, I think of history, I think of anti-racism, I think of education. I think the liberation for me personally has been learning what I was not taught, finding that information that was not presented to me in mainstream, and being proactive about obtaining that knowledge so that I could liberate myself and those around me from the lack of information. And then when I think of health, I think of serving and caring. And so liberation and health for me is just changing the context and allowing us to thrive in a context that, as you all have said, loves us, recognizes us, sees us for who we are, and allows us to learn and share. So I think it's changing the context of healthcare and naming the things that need to be named.
Thank you so much. I've heard so many inspiring things, from wanting to value sisterhood, to making sure that what we do to gain our liberation doesn't harm us and sort of deplete us completely, showing up as we are, showing up in peace, and being able to teach each other, and really making that a key part of health, not just this delivery of instructions, but a process of growth and learning, and being valued as a whole person, not just for these specific conditions, and liberating our minds as we do this work so that we can really serve the people that we care about. That's all so beautiful and so important. And so my next question gets at the issue of often when we think about health and disparities and health equity, there is this desire to define things and to say that, okay, this is our target. This is what we need to achieve in order to have health equity, or this is what will sort of demonstrate that we've arrived. And I think at the end of the day, this is a long journey. So setting a clear target may not be completely feasible today, but I do think there is value in defining what we want for our health, especially within this concept of liberation. So I'm curious if you had to sort of define maybe one goal, one target, one vision for what we should aspire to for our health, or what you dream of in terms of health and wellness for the people that you care for. What would that look like? And maybe this time we can start with Dr. Modupe Age and then go to Dr. Lorena White, and then Dr. Kai Parker, and then to Dr. Michelle Ogunwole. So thinking of the target is, as you said, very challenging because it is a moving target and it's an amorphous concept to define liberation. But to dream is what we must do in order to reach for a goal and to arrive at that point. And so in a very practical way, I think at this stage, liberation in health, especially thinking of maternal health, should be not being afraid of going to the hospital to go through a process that is part of life and is one of the happiest moments in your life, and to not have to go into that space afraid of dying, afraid of being ignored, afraid of being disrespected, afraid of being labeled. So it's, for me, it's arriving at that point where women of color, brown women, Black women, can come into the hospital and know that we've got them and we are paying particular attention to them. Thank you. Go ahead, Dr. Lorena White.
Piggybacking off that, in general, just universal equity, universal healthcare equity, and not in comparison to one group or another, but that we're all being able to access affordable, acceptable, appropriate care in a timely fashion without, again, having to think or consider or weigh in about the place that we're choosing to birth our children, or who's going to attend to me, or what is the race or ethnicity of my provider, but being able to, again, show up and know that you're going to be seen, valued, and heard from the time that you cross the threshold of an institution to the time that you leave there with a healthy mother-baby dyad.
Thank you.
All right, so I have to go back to the word docere, so important to teach people. And the reason is because I want them to be able to take care of themselves. I dream of a time when my clients can be their own doctor, when they can look at their own bodies, they can wake up and feel themselves and say, my head feels a little weird. I must not have had enough water last night, right? Or knowing certain things like, oh, my back is really starting to act up. This doesn't feel right. What's going on here? Where am I not feeling so supported in life, right? There are a lot of ways that our bodies speak to us, and we have never been taught to listen to it. We've never been taught what it's saying, and we've never been taught that we have the ability to make changes in our body just by making changes in our lives, right? We have that power, but we've never been told that. We've been told, go see the doctor, and the doctor will tell you what to do for yourself. Now, I agree. We need guidance. We need someone, holding our hand and taking us along that journey and picking up the pieces, right? We have that medical knowledge for a reason. And we have to empower our clients with it, not tell them what they should be doing with it. We have to empower them, especially when they're pregnant, right? To know that they are the important ones in the puzzle, not the doctor, right? Dr. Parker is not the important person here. You are the one carrying the baby. You are the one who we want to focus on, right? We made ourselves way too important. But like I tell people all the time, in a good birth, I am little more than a glorified house cleaner. I recognize the birthing person's importance. I recognize that they are there to have the baby. And if we leave them alone, their bodies will usually do a really good job of it. But we have to empower people because they are told so many other things their whole lives. We're seeing Hollywood, we're seeing the movies, we're seeing what birth is supposed to look like or what we think it's supposed to be like. And we've never actually seen it. I think that just teaching people, guiding them, educating them allows them to take their healthcare into their own hands and be more empowered to care for themselves instead of depending on somebody outside of themselves all the time.
Thank you.
It's so wonderful just listening to everyone's thoughts and ideas, and I'm so inspired by it all. I think, the question when you asked Lauren initially, when you said, what are our dreams? And I think for me, I have kind of three dreams when I think about Black women and Black birthing people. And this goes back to what I think that we deserve. So, I think we deserve to be seen in the fullness of our humanity when we walk into hospitals or wherever we choose to have our births and our experiences. We deserve not to be robbed of the sacredness of our births. And I think we deserve for our lives and our children's lives to be seen as precious. It's something that, I go back to a lot when I think about the dreams that I have for what it would look like to actually make some headway in this work of trying to achieve equity. Those are the dreams that I have. I think, Dr. Kai made some really important points about who is supposed to lead that. And I think, I've always felt like physicians or clinicians are not going to be the hero to this story. I think that women and birthing people themselves are. And I think I dream of a world where we can both hold systems accountable, but not always focus on the negative, and try to think about how we can center our joy and our experiences and our agency, and that be the center and the guiding force for the way forward, instead of the hierarchy that I think sometimes that we have, and that we could all use kind of our expertise, our knowledge in service of that.
Thank you so much. I really loved just sort of the arc of these ideas in terms of really standing up for our right to have access to healthcare, to be able to access healthcare where we do not have to fear for our lives while we're receiving that care, to center our needs, to really make us the center, our client, meaning our clients, the center of what is happening in any healthcare encounter, and to know our bodies, know our power, trust in that power, for folks to be empowered and seen as their full human self, and that sacredness and preciousness of who we are, who our babies are, and the accountability that all of that requires. Really beautiful, beautiful vision. Hope we can make that happen. And so with that in mind, I think it'd be nice to talk about some of the tangible things that we as clinicians try to do to make these things happen. And Monica McLemore, I love the way she has talked about sort of different phases of this journey towards creating a more just health system and healthcare for our community. And she talks about needing interventions at each stage, from what she describes as retrofitting, where we're making small changes to address people's needs right now, to reform, where we're changing policies and practices, to reimagining, where we're really transforming systems and care. And I'm curious if you can share an example of something that you are trying to do or have tried to do through your care or your work to help us get towards this vision of health and liberation. And it could be something that you do as your clients, or a project that you've worked on. It could be in any of those phases, retrofitting to
naturally benefit one patient, one client, is amazing. And patients feel it, they understand it, they love it because they feel held. It's a space that they walk into, and seeing not only practitioners that look like them, but also understand the nuanced dialogue, the nuanced language, without having to navigate the microaggressions or the other different hurdles that often are met with when entering a hospital or a clinic or even a private practice, where again, they're just not seen, valued, or heard. And so really taking into account what healthcare could be, what it should be, and making that a reality is so very important to me, because I know it can happen. I see it happen every day. And then just having others who we partner with who embody that same vision in their work and are being able to walk beside us and walk together with us, so that again, we can advance maternal health and wellness initiatives all over, so that again, we rise, we're free, we're liberated together.
Thank you. Dr. Lorena White, can you say a little more about sort of the team of different practitioners that you're working with to create that synergy?
Surely. Myself, I'm an OB-GYN by trade. I subspecialized in reproductive endocrinology and infertility. I'm also an acupuncturist and a traditional Chinese medicine herbalist. And then we have a pelvic floor physical therapist, a Reiki practitioner, a chiropractor, a health and wellness coach, a nutritionist, dietitian, vaginal steam facilitator, raindrop therapy, a licensed social worker who does our focus groups and our social, our support groups, another acupuncturist, who am I forgetting? Our team is getting so big, a doula, a lactation consultant. Our team is growing so big. But as you can see, it's a plethora of not just, we have a midwife, and again, not just the traditional medicine, but also conventional medicine as well, but working together for the benefit of the patient.
Wow, that sounds amazing. Thank you so much for sharing all of that.
I think I was next.
Yeah.
That does sound incredible. And I might take a little bit of a different approach, because I work with women and birthing people kind of in the preconception and postpartum period, and interpregnancy period. But a lot of my research has to do with thinking of interventions and system level interventions that improve maternal health equity broadly. And so one of the things that I have worked on and have been working on has been the role of doulas, and I in helping us, and not just any doula, like a community-based doula who's part of the communities that they serve, and they have some connection to the clients that they serve as well, and they have some awareness of the needs that go beyond, the immediate healthcare issues that people may face, that they can be attentive to that. And so I think that a lot of the work that I have been doing is trying to figure out how we can make sure that anybody who wants a doula has access to a doula. So that's one piece of it. And I think kind of going in a slightly different direction, when we think about equity more broadly, and we think about the people that are serving as doulas, especially when we have Black women serving as doulas as well, I think a lot about making sure that there's equity in the work that they're doing, and so that they're compensated, and that there's ways to make sure that they actually are available to do the work and help Black women and birthing people. Just because equity goes both ways. So we can't ask Black women to save other Black women, but we're not being responsible for thinking about the ways that it impacts their health overall. And so I know that's a kind of a different way to look at it, but thinking a lot about when we think of interventions for health equity, for our healing, for our wellness, and for our well-being, that goes back to my idea of making sure that it's not costing us more overall. And so I think there's a lot of research about how doulas can improve birth outcomes. I've had a doula, and it's such an important experience for me. But not everybody has access, and there's inequities there too. And so, thinking about, in terms of the question I think that Lauren posed, how do we do that differently, is making sure that it's a sustainable resource. And part of that has to do with making sure we have a plan so that doulas can actually access clients, and that they can be in the workforce, and that there's equitable access for them to actually get into the workforce and reach birthing people.
Thank you. And Dr. Modupe Age.
Yeah. So I really like that model of retrofit, reform, and reimagine, because I felt like it helped me organize my thoughts a little bit, because this stuff really, it's a passion for me, because it's me, it's my story, it's my mom, it's my cousins, it's my sisters, it's real, and it matters. And it matters here, it matters across the Atlantic Ocean and everywhere else. So this was a good way for me to structure it. And I think that in terms of the retrofit, I realized that through implicit bias training and other opportunities to really, again, name what needs to be named, right? I think some of us have the experience. We know what's happening to us when we're in the hospital, but everybody doesn't acknowledge it, and everybody doesn't recognize it, and everybody doesn't want to hear about it. And so to have gotten to a point where I can use the words that are published to make this information mainstream, and to use the words fluently enough so that other people can learn to use the words, like racism. How often do you hear that word when you're in a health setting or a clinical conversation? And it has to come into the conversation, because it is one of the issues that impacts the outcomes of Black and brown moms. It's not their skin color that increases their risk factors. It's the way they are treated based on their appearance, and we need to say it. And I'm really delighted to find lots of publications. I've purchased books on racism in public health, and so I'm also reading more so that I can use this language routinely, whoever I'm talking to. And I really relish sharing that with my patients when I'm still on labor and delivery, just letting them know, I know what's going on, and I'm paying extra attention to you because you are a Black mom, and because we know that Black moms have worse outcomes. I let them know, and I verbalize it in front of the whole clinical team, so that everybody knows that's what we need to be doing, and it's okay we have to say it. We have to acknowledge that this is the context of healthcare that we're working in, and it has to be named. So that's my retrofit, is that I've started naming it and saying it out loud in front of the whole clinical team, so that everybody realizes what we're dealing with, and everybody is extra careful. So I try to up the ante in terms of the clinical team taking care of that mom, saying, listen, we have to pay attention to her even more than we would anybody else, because we know how she's affected by this system and by some of the discrimination. So that's my retrofit, is, again, naming it. And in terms of my reform, as you mentioned, I'm now in Baltimore County Department of Health as the director of the Bureau of Clinical Services, and I've been in this position for about 6 months. And it's a real privilege to be on that side of healthcare, to understand how do the resources get allocated, and how do we target certain groups, and how do we define the high-risk populations, and where are they located, just really using that population health, which I'm sure Dr. Ogunwale, as an epidemiologist, you probably really enjoy that as well. But looking at the population health, and really thinking of reallocating resources where they need to be, is one of my processes in terms of my reform and my advocacy. And in terms of reimagining, I would love, again, I feel like I keep going back to the same thing of naming what needs to be named, but I would love to read papers that, instead of saying Black women are at higher risk of maternal mortality, that we would see a title that says racism increases the risk of mortality, so that we understand what is the cause, what is one of the causes of this issue, and what is the modifiable risk factor. That's my imagine.
Thank you so much. Very comprehensive. Thank you. And Dr. Kai Parker, yes, you are next.
All right. So for my response to this question, I have to go back to Dr. Michelle's first point. You got to bring the love back. You got to bring the love and the care back into this work. And that is what I find is missing so often. You know, I have a lot of clients who are coming to interview me for home birth or even just midwifery care, even if they want hospital births. And the stories that I'm hearing right now are absolutely breaking my heart. Like so much so in the beginning of the pandemic, I didn't know if I was going to survive because I was like, yes, I'll take you. Yes, I'll take everyone. Just everyone come here. Let me please love you and care for you during your pregnancy, because the stories were horrific. And unfortunately, I'm hearing them way, way, way too often. We got to put the love back in. For me, I love my clients, and my clients will tell you, ask any of them, they feel loved, they feel respected, they feel heard, right? I get to know them. I have a terrible memory. I might forget the minor details, but I hear them and I'm with them and I laugh with them and I cry with them. But I have the time to do that. And I'm grateful to be in a practice where I can create that time to be with them in that way. But I can't do it any other way. Like I can't travel through a woman through her pregnancy and see that she's a little bit sad and just be like, oh, well, I've measured your baby and I've heard those heart tones. We're good. See you next week. I can't do that. I see pain in my clients. I have to ask, are you okay? What's going on? I see the couple and they're acting funny. I have to ask into that. Excuse me. What? I mean, look, you know, I know you here. Like what's happening? What's going on here? And that's so important because we're not just supporting this pregnancy. We're supporting this family. We're supporting this unit. We're supporting what happens after this baby comes out. In order to best do that, you've got to get to know your clients. I have to. For me, it's just not optional. You know, when we were studying at Thai Sophia, one of the things they used to say is, when you know a person's story, you can't help but fall in love with them. Like you can't help but fall in love with your clients when you hear their truth. But if you don't take the time to get to know them, you will never hear that truth. You won't really get to know them. You can't provide quality care if there's no care. You have to put that time in. I once heard a woman say that in the beginning of people's pregnancies, in the first couple months, you know, our mission is to fall in love with them. That is our mission. The baby's taking care of the baby, right? Never in the history of pregnancy has a woman ever had to look down and say, all right, kid, grow an arm now, right? Like we just don't have to do that. We don't have to direct the process. The body works so beautifully, usually when we leave it alone, right? But we have to do there is provide the space. We have to hold space for families and hold space for couples. And again, we can only do that if we truly care enough to do so and care about them. So I get to know them. I ask all the things. I ask all about what's going on in their lives and their worlds, because these are the things that come up in pregnancy. These are the things that come up in labor. And when they come up in labor, they tend to do things like dystocia and stop babies from coming out because they're too busy worried about the things that weren't taken care of during pregnancy because nobody bothered to ask them. You know, I am often accused of giving way too much time and energy to my clients, but I know that that's what this work requires. Not would benefit from, but requires. My clients have my cell phone number, and I know people will judge me for this. They all have my cell phone number. They all have 24-hour access to me. If they need to call me, they can call me. They can text me. They can FaceTime me in the middle of the night and show me things on their babies. I will look a hot mess, but I will answer, because if I were a new mom, that's what I would want. Somebody who is there for me, somebody who is truly there in the way that, like, I not only can call and say, oh, well, my doctor said I can call her at midnight. No, they know me. Kai, what's up? What's going on? What's happening here? But you have to have that type of connection. You have to have that type of trust in your provider to be able to reach out. Because if that connection is not there, what might happen is they may say, oh, I really don't want to bother her. I know this is weird, and I know that this is what's going on with my baby, but I'll wait until morning, right? But with a newborn, that might be too late. So I do give them access to me for 6 months after their babies are born. But for 6 months, there are things going on that in the middle of the night, they might be freaked out about. And I want to make sure there's somebody who can pick up that call and care about them. Can't do it by myself. And I know that there are a lot of other people who are out there doing it. But this is what needs to go into all of medicine, not just midwifery care, not just Kai care, not just midwives and DC care, but all of maternity care. So I kind of answered all three questions in one. But we got to put the love back in there. We got to put the care back in there. You can't provide quality care if you don't care.
Wow, thank you. That's a brilliant point. Yes, you have to care. You have to care, and there has to be love there. And you all have shared such beautiful examples of ways that you show up for your patients and for our community and for the people we care for with love. And I want to say a special thanks to Dr. Kai Parker, because I know that being a solo home birth provider is very, very intense work, and it is an absolute gift for someone who's had a home birth myself but has never worked as a home birth provider. I know it is a tremendous gift that you are giving to your clients, and you are really giving of yourself in a way that is just tremendous, and very few people can do that. So thank you for that gift.
Thank you. And I do just want to follow up and say it's a true gift to me too. You know, last Friday I had 2 appointments in DC, and then one I drove to Bethesda, and then from Bethesda I went to Columbia. From Columbia I went down to Waldorf. I got home around 9:30, and my husband was like, "Why are you so full of energy?" Well, I'm not working. I love what I do, and that I am grateful to say, at least in my community of birth workers, I am so grateful to see so many people who just love what we do. This is a calling, right? It's not, nobody says, I think I want to wake up at 3 o'clock in the morning and go to other people's homes and catch their babies, right? Like it was a calling. And I think for so many birth workers, that's just the case. We can't do anything else. This is what we were put here to do, and we know it. So it's a gift to me too.
Thank you. Thank you. I want to make sure, since we're coming up towards the end of our time, that if there are any questions, that we address them. I've seen some beautiful comments in the chat, beautiful reflections on what folks have said tonight, reflections on providers. A shout out to Dr. Age for being there for a postpartum emergency. Really wonderful, wonderful comments. But please, if you have any questions you'd like to direct to our panelists, please share those there. And since we do have to wrap up, I'd like to, if I can, just give our panelists a moment to share a last word, and just whatever you would like to share briefly, since we only have about 5 minutes, in terms of your reflection on tonight, or a story about that sort of centers the people you care for, something brilliant or wonderful that you've seen them do, but just whatever you'd like to share. And why don't we start with Dr. Kai Parker, and then Dr. Madupe, and then Dr. Lorena, and then Dr. Michelle. Okay. You're muted, Dr. Kai.
Okay, well, what you missed was, okay, all right. So the first thing that comes to my mind is this, because I think it's actually pretty cool. You know, I have an office in Columbia, but since March of 2020, I've been working out of my basement in my car. And I've got some criticism for remaining virtual, although I do go do home visits. But I have to tell you, these virtual visits have been really, really, really cool. And one thing that I have seen from families is something that I have not seen as much when we were not virtual. I send all of my clients a Doppler, a blood pressure monitor, urine specimen cups, urine test strips, and a scale, right? But the coolest thing that I'm seeing is they are getting so much more comfortable with their own health and with taking, again, matters into their own hands. Their partners are showing up for all the visits because they are there to put the Doppler on the bellies. They are becoming more involved. And I'm seeing like partners and everyone having more questions, being more involved in the like neonatal period when the baby is here. And it's really, really cool to watch that, right? I'm moving back into a space where I'm in person again. And as it stands right now, I'm loving watching families working together and being empowered and becoming better partners, becoming better fathers, becoming better moms, becoming more confident in themselves and their own abilities. So I don't know, that's what comes up for me that I'd like to share with you all.
Thank you.
I'd like to share about a historical figure that I discovered. So in my process of educating myself, I required or requested that my colleagues share stories about historical figures in American history during the month of February. And as part of that effort, I made it a point to learn about somebody that I had never learned about in the past. And so I read about Dr. Rebecca Lee Crumpler, who was one of the first Black female physicians who graduated medical school in, I think, 1863 or 65. So right about when slavery was ending, she was graduating from medical school and then went to work at the Bureau of Freedmen in Richmond, I believe. And then she went on to publish a book in 1883. And that book is available on Amazon Kindle. So I bought the book because I thought that was just amazing that several hundred years later, as a Black physician, woman physician, there's still so few of us, and she was one of the pioneers. And so there's a quote in her book that I really that really struck a chord for me, and so I'd like to read that. And I'd also really like to encourage all of you to get her book. Title is A Book of Medical Discourse, and I think it touches on everything that we're talking about because she's educating the community. She's talking to them about, this is your body, this is where your liver is, this is where your stomach is, and it's written in a way that's accurate and accessible, and it covers so much information. But the quote that I'd like to share that she wrote and still resonates today is, "My chief desire in presenting this book is to present upon somebody's mind the possibilities of prevention." So it seems like it's still the same mission that we're carrying forward, and it's a privilege for me. It's really a privilege.
Thank you. Dr. Lorena.
Wow, I can't believe this time is already up. This has been fantastic for me. And I think as we talk about reproductive health, reproductive rights, reproductive justice, one thing I can see is that it doesn't come in one shape, form, or color or size. We've talked about love and sisterhood. We've talked about the value and the importance of education, teaching, learning. We've talked about naming a thing so that it has a name, and a name that's not to be forgotten or easily lost in the proverbial sauce. We've talked about being seen, heard, and valued in a system that does not see, hear, or value people that look like us. But that is the power of the healing process, combining all these facets into the administration of care, the receipt of care, and just that whole system of revolutionizing care from the inside out. And it's not the practitioner on the onus of the practitioner, but those who are in the system, not just in the system, not just of the system, but changing the system. We can do this. And I see it happening in different pockets and in different conversations every single day, because we do have that power, and we have the power to reclaim that, because we are being empowered by different providers, by different practitioners who see and know the value of their clientele and their patients. However, we have to know that as a collective. We have to know that as a tribe. We have to know that as a team, because together we can change the system. We can change the world, but we just have to stay the course and know that we're better together. And synergistically, we can do anything but fail. Thank you.
Ashe, thank you. That is true. Right. And Dr. Michelle, wrap us up.
Okay, I will be quick because I think everybody had just such beautiful points. And I'll just end with, some closing quotes from people who inspire me. And I think is very reflective of what we've tried to do here today. And this is from Bell Hooks. And she said, "Rarely, if ever, is any of us healed in isolation, that healing is an act of communion." And I think that really gets to the heart of why we gather and why we have these conversations. And so I wanted to leave off with her words, which are better than mine. And I think one final quote that I think about, because I started talking about love, I'll end with that too. And Cornel West said that justice is what love looks like in public, just like tenderness is what love feels like in private. And so I think that I challenge myself and all of my colleagues to think about how we practice that love in our private interactions with our patients, and as we do this work, the tenderness that we extend to them, but also in the public facing stages that we have the opportunity to show love through showing our commitment to justice. So I just appreciate this space and have learned so much. And thank you for giving us all this time together. So.
Thank you so much. Thank you all for taking the time to be here tonight and share your wisdom and your experiences and the brilliant work that you're doing. And I think it's so amazing that this is a group of clinicians just in this local area that I think is a reflection of our brilliance, of our talent, our skill, our love, all that we as a community can bring to health and are bringing to health and to our liberation. And so I feel very inspired and a lot of faith that we will get there because of us, because of all that we are, all that we've been. So thank you all so much for all that you do every day. And thank you everyone who's been with us here tonight. Thank you, Bloom, so much for creating this space. And I hope that everyone will continue to tune in to the Black Maternal Health Week events that Bloom is beautifully putting on for us to highlight all that is needed and all that we have to fix these challenges. So thank you all.
Thank you for having us.
Thank you.
Thank you.
Thank you.